So what do you do when a child's been molested? Well, first thing, you may want to know that the child was molested. Sometimes kids will come forward and say, Mommy, Daddy, Aunt, Uncle, somebody touched me and this happened. In our documentary Boyhood Shadows, our main character Glenn talks about going to his mother and saying, my ass hurts. And she thought he was just using a dirty word and punished him for it and ignored the fact. Sometimes kids will be forthcoming. Most of the time, though, they won't. So how would you know with all this talk about child molestation? Well, first thing I think parents should know, not all kids are molested. It actually is a big story because it doesn't happen to everybody. Just like any kind of news story, it's news because it's different. It is not an everyday occurrence for everybody. If your child doesn't come forward and tell you, you might know, or you might suspect, the red flags as we call it, is if you see a sudden change in behavior from your child. Quite often the people we work with, what we do is we ask them to bring in pictures of themselves as a child before and after the abuse started. So before, one picture that we've got that is very poignant to this shows a little boy at his baseball league. He's got the bat in hand and it's the annual photograph and this big smile and bat. And the next year, exact time of the year, same baseball diamond, same coach, same child, maybe different uniform, I don't know, maybe he grew just a drop. I'm not sure about that. But what you see is this boy holding back. And he's not smiling. And you can see in his eyes, something happened. Something changed. So when we see a rapid change, we see a change where somebody is withdrawing. When kids withdraw, that can be a red flag. Also, when kids all of a sudden take an interest in adult activities. So if kids are playing with, let's say, dolls and Play-Doh one day, and all of a sudden they are dressing up and wanting to play as if they are some kind of glamour sex star, that can be a red flag. Fire setting is a very common red flag. Lots of times spreading feces is a cry for help. So if any child is spraying the feces, we want to investigate that. That is not something typically kids will do. Also, if kids either become avoidant of adults or specific people or very clingy. So if you have a child and all of a sudden out of nowhere, child's clumping onto you, doesn't want to be left alone, wants to always go with you, maybe is afraid of some adults or adults altogether, that is something to be concerned with. Bedwetting is a common symptom of sexual abuse. Bedwetting, fire setting, clinging, don't children do these things anyways? Yeah, lots of times. But what we do to sort this out is we look at quite a long laundry list of symptoms. Depression, masturbation, inserting objects into their rectum, talking about sex, showing age-inappropriate knowledge about sex, runaway. When kids are little, if they're very small, if they're a toddler, they can't run away. So we can't see it yet there. However, for a toddler, what they may do is they may freeze up. So it's very common for a toddler to recognize something's wrong. They can't speak, they can't pick up the phone, call the police, they can't tell their therapist. What they can do is shake and get stiff and look frightened. That is a sign of concern for the child then. What about later in life though? What if we didn't catch that? That's a good one where we can track it. Because if they are stiff like that as an infant or toddler, then when they grow up, they're bound to walk around stiff. Years ago in our American politics, we had a lot of fun with Al Gore's stiffness. He made a joke of himself as he was running for president about, he was standing there stiff and said, "Want to see me do the Macarena? Want to see me do it again?" And it was a joke about how stiff people thought he was. When people walk around stiff as adults, that's an indicator that maybe they were sexually molested at a very, very early age. For boys, now grown into men, One way this plays out is that they may stiffen their body like a board when they ejaculate, and that they cannot do that without it. The running away behavior, for a little teeny toddler, they can't run away. However, young children run away, and maybe they'll take their backpack and maybe leave a note, and they run away. Where do they run away to? Down the street to a friend's house. They're usually back in a few hours. Teenagers run away, and they leave home. The vast majority of kids who run away in America are running away because of one of two reasons. Either because they are being sexually molested, or because they are transgendered and the parents won't accept it. So they literally run away. Now as an adult, how do they run away? Well, as adults we don't typically run away the same way. What we do is maybe frequently relocate. Maybe join the military, which conveniently will have us relocate every few years. We can run away from responsibilities. We can run away from relationships. Turning to drugs and alcohol, we can run away from emotional pain, run away from ourselves. So we track these things. So if parents, guardians, teachers, anybody who's around children, see these sudden changes, see some kind of acting out behavior, see some kind of shutting down behavior, see something that just doesn't seem age appropriate, then you may want to talk to the child. And it's very helpful simply to say, what's going on? Ask them, are you okay? Did anything bad happen? Has anybody touched you in a way that you shouldn't? Now, of course, education is very important. If we educate our kids first and teach them to come forward and let us know if somebody's touched them, that would be very, very helpful and prevent a lot of this. However, even with the best of education, we're going to have some kids who won't report. So ask what's happening, what are they doing? Be involved. We know that parents and guardians who are involved with their children catch these things much quicker, and the kids are much more likely to tell the parent or guardian if something is happening. So if you hear this stuff, definitely good thing to do is call the police, make a report, call Child Protective Services. You don't have to be a professional to do that. Get in touch with your local rape crisis center, or perhaps call therapists, have the child seen by somebody who works with children, who knows how to recognize this, and allow the experts, the police, the rape crisis center staff, the therapists, to do their assessment. From there, it will determine whether or not there needs to be some kind of legal action, whether there needs to be ongoing therapy or not. If the child does not say anything, and you don't see any symptoms, probably the child's okay. Now, if you see a few symptoms, don't be alarmed. Because again, most of these things kids will do at some point anyways. So kids masturbate. Boys masturbate. They play with their penises. If every boy who plays with his penis, who's witnessed by an adult playing with his penis, was molested, then we could safely say every boy is molested. And that's certainly not the case. Don't panic. Check it out. Sometimes it is just child's play. Sometimes it's very innocent. Sometimes little boys want to wear girls' clothing, little girls want to wear boys' clothing. Sometimes they want to pretend like they're adults. Sometimes they'll talk about sex. And that's all natural, that's all proper, that's all okay. It's if you start to see many of these things, or anything big, like the fire, say, like the spreading of feces, if you see any rashes, if you see any kind of damage to a child's behavior, certainly if blood is coming out of their penis, vagina, or anus, you want to definitely get some help immediately.